Morning.
Okay, good morning, everybody. And Dawn Lanford is here from the Alzheimer's Association. And she is going today to be presenting the 10 ways of, now I'm going to say this wrong, so Jennifer and Dawn can correct me, the 10 different common symptoms of dementias.
Yes, it's the 10 warning signs of Alzheimer's. That was close. That was close.
Okay, well, welcome, Dawn, and we're ready.
All right. Good morning, you all. Let me share. Can you guys share my screen? See my screen?
Yes.
Okay,
Yes.
great. Okay. All right. So good morning again. As Roxanne said, my name is Dawn Langford. I am a community educator with the Alzheimer's Association. I have just completed my student practicum with them, and I am now a volunteer, an official volunteer, and not just a student volunteer with the Alzheimer's Association. So it's good to see you guys again. I think I was with you guys last month talking about understanding Alzheimer's and dementia. So this particular program is designed for those who want to learn more about the warning signs of Alzheimer's and other dementias, and those who have noticed memory or thinking changes in yourself or others. So throughout this presentation, we're going to see a number of videos that have taken place in various settings. So please let me know if you guys have trouble hearing these, or myself as we go through. I'll do my best to try to figure out what's happening if that's a problem. So let's take a look at what we're going to talk about today. You guys can ask me questions throughout, or we can do questions at the end. It's whatever you all want to do. I don't mind taking questions throughout if you guys want to stop me at any point if you have a specific question about what I'm talking about. So today, we're going to explore the most common warning signs of Alzheimer's to help you be informed about what is normal aging and what is not. So by the end of today's presentation, the goal is for you guys to be able to understand, describe typical age-related memory, thinking, and behavior changes, recognize common warning signs of Alzheimer's and dementia, and discuss tips for approaching someone with memory concerns. We're going to explain the importance of early detection and the benefits of diagnosis, identify possible tests and assessments in the diagnostic process, and name the resources available through the Alzheimer's Association. So throughout today's presentation, we're going to periodically check in with the Garcias. They're a fictitious family following along as Mary's daughters discuss their mother's memory changes and take action to find the cause. Please note that the Garcias experience might be common, but it does not represent the exact experience for everyone, as situations vary from person to person. So, Mary is a 73-year-old widow who lives alone. She's a retired teacher. She's always meticulously cared for her house, and her daughters have recently noticed laundry piling up and mail along with newspapers scattered around the house. Lydia is the eldest daughter of Mary, who has two daughters. She lives a few miles away from her mom, and she visits her mom frequently. Patricia lives in, come on, computer. Patricia lives in another state. She works a lot of hours, and she can't visit her mom very often. But she talks to her sister Lydia a lot about her mom via phone call and text. So Lydia is concerned about their mom's noticeable lack of tidiness. And so she reaches out to her sister Patricia, who again doesn't live in the state, doesn't have a lot of contact with her mom other than text and phone calls. So Lydia tells Patricia that she's worried about her mom. She keeps losing things and the house is a mess. But Patricia thinks it's probably normal aging because, of course, you forget when you get older. But Lydia isn't so sure. She thinks that maybe there's something else going on. So she wants to Patricia wants to reach out to their mom's doctor, Dr. Salloway, right away. So I just want to point out before I play this video from Dr. Salloway that although this is a fictional scenario, Dr. Salloway is in fact a real MD. He's been recognized as a leading expert in aging, Alzheimer's disease, and many other memory disorders.
I can't hear what he's saying.
I can't either.
Okay, guys, hold on. I'll fix it. I'll try to fix it. Did you guys hear that?
Mm-hmm.
The ding? Okay. You heard it? Okay.
I heard
So
the ping.
Yeah.
I heard that.
You were supposed to hear that when the little text message came up on the screen. I apologize. I didn't know you guys couldn't hear. Okay, let's try to hear from Dr. Salloway again.
As we get older, cognitive problems become more noticeable for almost everybody, and it can vary from person to person. Typically with age, people have trouble coming up with the word they want right when they want it. They have trouble remembering names, and they don't think quite as quickly. What's more concerning, or what might be the beginning of a memory problem, is people have a lot of trouble coming up with words or names, and it's happening more frequently, and the words or names don't necessarily come to them later. And then they start misplacing things, but not just once in a while, because we all misplace things, but more often. And it begins to interfere day to day. That should be a warning sign for people that this might be the beginning of a memory problem.
So a little bit about my background really quick. I don't know if you all remember, I have 2 loved ones right now, including my dad, who is suffering from a form of dementia. And that was one of the early things that we noticed about him. So that's definitely something to look out for. So today we're all here to learn more about Alzheimer's and dementia and identify common warning signs of the disease. You may have heard the terms dementia and Alzheimer's used interchangeably. While they are related, there are significant differences between the two. You guys may remember that from last month, understanding Alzheimer's and dementia. So let's hear more about this from some dementia and association experts. First, the association with the Alzheimer's Association is Dr. Heather Snyder. She's going to discuss what dementia is.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
So I believe someone asked me this question last month, but Alzheimer's is the most common form of dementia, accounting for more than 80% of all cases. So next we're going to hear from Dr. Hartley and what the disease is and what it looks like in the brain.
More than 100 years ago, Dr. Alice Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells, or neurons, throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
So lastly, we're going to hear from another Alzheimer's expert about the importance of recognizing the warning signs of Alzheimer's.
It's important to know what the warning signs of Alzheimer's are and to be on the lookout. We know that we change over time, and the warning signs of Alzheimer's can be warning signs of a number of things, but when you see those in yourself or in someone you care about, it's important to check it out, to consult with a doctor, to find out what you're dealing with.
So, as we heard, it's important to know what the warning signs are and to be on the lookout for these marked changes. The Alzheimer's Association is a leader in this area. As a leader in this area, developed a list of 10 warning signs to help people understand the difference between normal aging and common signs of possible dementia. The list is intended to be a tool to help identify unusual changes in a person's memory, thinking, or behavior. It is very important to note that this list does not constitute a diagnosis of Alzheimer's or dementia. These are simply the most common examples of changes experienced. Individuals may experience one or more of these signs to different degrees. So let's look at each sign and what are some typical age-related changes and what they may look like. Memory loss that disrupts daily life. Memory loss that disrupts daily life. One of the most common signs of Alzheimer's, especially early on, is forgetting recently learned information. Others include forgetting important dates or events, repeatedly asking the same question, and increasingly relying on memory aids or learning or leaning on others for things or tasks once handled on their own. A typical age-related change is sometimes forgetting information but remembering it later on. Number 2, challenges in planning or solving problems. Some people may experience new difficulties in executive function, including developing or following a plan or difficulty concentrating. Conversely, a more typical age-related change is making occasional errors when managing bills or household finances. So let's hear from John, who's living with dementia with Lewy bodies, about how he experienced this early warning sign.
I was probably spending 4 to 5 times more time preparing for something than I did, say, 5 or 10 years ago, because of the, I would lose my thought, I'd lose my focus, I'd get anxious, I wouldn't get to sleep. I was thinking, I was in my sleep, I was thinking about what I was anxious about, which was I was trying to remember, which was I was trying to prepare, which I was trying to do. So it was really a vicious circle of, so I was able to control it a lot, so that people on the wouldn't see things and that there weren't things to be seen. It's what was disturbing me was what effort I had to put into to do the things I used to do more easily.
So, number 3. Go back, computer. Oh my goodness. Thank you. Difficulty completing familiar tasks. People living with dementia often find it hard to complete daily tasks that used to be managed with ease, such as driving to a familiar place. This is extremely common. Writing a grocery list or remembering how to play a favorite game. Conversely, a typical age-related change would be occasionally needing help to use a microwave or remote, or this could include having trouble with technology that a person hasn't used before, like how to hook up a new DVR or DVD player, or connect your laptop or iPad or phone to the internet using Wi-Fi. So let's hear a little bit more about this warning sign from a dementia care expert.
Some people have difficulty with math or with reading in a way that's unusual to them. And once again, this is a change in that person. So for example, we all know somebody who was never able to balance their checkbook, right? So that wouldn't be a warning sign for them. But if somebody who always balanced their checkbook to the penny suddenly was paying bills, the same bill over and over, and not able to balance their finances, well, that would be a sign for them.
So number 4, confusion with time or place. An individual living with Alzheimer's or another dementia may lose track of dates, seasons, and the passage of time. They may have trouble understanding something if it's not currently happening, or becoming confused about what or where or how they got there. This can become more dramatic or profound in the middle and late stages. A more typical age-related change could be getting confused about what day it is or when a scheduled appointment is, but figuring it out later. This is it's a personal story. This is a huge issue right now for my dad, losing track of dates and the passage of time. And if it's not future events, he has a really hard time understanding future events. So we try not to live in future events. We just keep everything in the present moment. And it's just a lot easier for him. Number 5, trouble understanding visual images and spatial relationships. Trouble understanding visual images and spatial relationships. Some people with Alzheimer's or another dementia may experience vision problems, which can lead to difficulty with balance, trouble reading, and any problems judging distances and determining color or contrast. This can all impact driving or navigating the environment around them. Vision changes such as cataracts and are a more typical age-related change and has nothing to do with Alzheimer's. This sign shows us that these changes are not just about memory. It's important to think about all of the other ways that someone's daily life may be impacted by any of these changes. Our experts can explain a little more.
Alzheimer's disease is not just a disease of memory. It can affect other things too. It can affect the way that we perceive what we see. So sometimes somebody in the early stages of Alzheimer's might go to the eye doctor because they're having trouble seeing, and in fact their vision is just fine, but the way they're perceiving what they're seeing may be difficult.
New problems with words, speaking, or writing. Individuals may have trouble following or joining a conversation, stop in the middle of a conversation and forget what they're talking about, and continuously repeat themselves. They might also struggle with finding the right word or call things by the wrong name. They may start using more descriptive terms to talk about something rather than the name of the actual item. A normal age-related change, however, would be occasionally having trouble finding the right word. So let's hear from Phil. He's living with Alzheimer's about this warning sign.
The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life, you know, as an avid reader, as a reporter, as a writer. I struggle with them now.
That's tough to have been able to been, you were proficient at something at one point and then suddenly you're not. That's hard on not only the person, but their family. Number 7, misplacing things and losing the ability to retrace your steps. I'm pretty sure that I struggle with this on the daily. And I am not diagnosed with a memory disorder, but this sign is often causes concern for people. I want to clarify that this is not about just losing your keys on occasion, misplacing things from time to time, but this is not being able to retrace your steps to find them. A person with Alzheimer's disease may lose things and not be able to recall when it was they were last seen or identify the location it was placed. He or she may put things in unusual places, such as putting shoes in the refrigerator. Because the lack of executive function and awareness is affected, the person may grow increasingly suspicious of others and start accusing others of stealing and do so more often over time. So let's hear experiences from Ruth to explain the signs further.
So some people wonder if, if they lose their keys or their glasses or their purse, is that a sign of Alzheimer's? And one thing that I would say about that is, for most of us, we might misplace something, but then if we retrace our steps, we can usually find it. We can usually remember. For a person with Alzheimer's, sometimes they're not able to retrace their steps. Sometimes that memory is just gone. And so when they do find their keys next to the phone because they got interrupted by a phone call when they were coming in, they set their keys down in an unusual space, so there they are next to the phone. If that happened to you or me, we'd probably remember, oh yeah, the phone was ringing when I came in the door. I put down my keys. The person with Alzheimer's might not remember. They might wonder who's moving their keys around because they never put their keys by the phone. So that's just a little bit of a difference in some of the dynamics with losing things and Alzheimer's.
Number 8, decreased or poor judgment. Individuals may experience changes in judgment or decision making, such as using poor judgment when dealing with money or paying less attention to hygiene and grooming. This can be especially common in individuals who live alone. Making a bad decision once in a while, such as forgetting to get your oil changed in your car, is more of a typical age-related change. So let's hear from Teresa to explain a little bit more about decreased or poor judgment.
The way I kept my house, I wouldn't say I was OCD, but pretty close to it. And all of a sudden, everything was okay with me. It's like, oh, it's a pile, I'm tired. So my dining room table usually looked like it was someone's office, because I always would say I would do it tomorrow. And then my bedroom, as far as clothing, I would just put it in a corner, put it in a chair. And all of this is just, I wouldn't say it looked like I was a pet wreck, but really I was, because I never threw anything away. I always would say, I'll get to it, but I never did get to it. So just the way of my standard of living, it was actually decreasing.
Number 9, withdrawal from work or social activities. As we age, it's normal to feel uninterested by family or social engagement at times. However, someone who's experiencing dementia-related changes may start to lose their ability to hold or follow a conversation, and as a result, begin withdrawing from social encounters or hobbies. They may lose the confidence to engage in that way. Let's hear again from Dr. Salloway about withdrawal from work or social activities.
One of the most common changes, and early on, is the person's comfort zone shrinks a little bit, and then that gets worse throughout the course of the illness. So they're less comfortable going out, they're less motivated to do things than they were in the past. So there's some change in day-to-day functioning that way. I think people also lose confidence in their cognitive abilities because they may not recognize someone or know their name or find the right word, and they'll feel awkward, and they don't want people to notice that, so they feel more comfortable at home or in situations with family where they're very, very comfortable with that wouldn't concern them. So people tend to withdraw a little bit and be less outgoing. That's can be one of the early signs of Alzheimer's.
And lastly, in our 10 warning signs, changes in mood and personality. Individuals with Alzheimer's or another dementia may become confused, suspicious, depressed, fearful, or anxious. They might get easily upset either at home or when out of their comfort zone. As we age, however, it's normal to develop very specific ways of doing things and become upset or irritable when our routine is disrupted. Someone with Alzheimer's or dementia may become fearful, angry, or easily frustrated, which is something that should be addressed. Dr. Salloway shares more about this.
Another early sign of Alzheimer's or dementia is subtle changes in behavior. So all of a sudden, the family may notice the person is more easily irritated, or more impatient, or a little moody, or have a shorter fuse, or more anxious. Now, there's lots of things that can cause that, but often that can be an early symptom of Alzheimer's or go along with the early symptoms of memory loss.
So as we move forward, let's check in again with the Garcias. As we talked about earlier, Mary's daughters are concerned about the changes they're observing in their mom. They want to know when it's time to see a doctor about the changes they've witnessed. So let's take a look at their text conversation. So as you can see, the daughters remained concerned as they took their mother to see a doctor. So let's hear what Dr. Salloway has to say.
Memory is not all or none, especially when there are early symptoms or signs. So on a good day, people might function very well and not really no one notices there's a memory problem. But on other days, especially if they're tired, then things become more noticeable. So memory is variable. It's not all or none. And then there are different type of symptoms that develop for each person. So some people may have trouble with language, may have trouble with organizing themselves, may have trouble navigating while driving, and other people don't have the same symptoms. So you don't have to have every symptom of Alzheimer's to be concerned. And I think the most important thing is determining what has changed from that person's normal level of functioning. And usually people have a pretty keen sense of, what they can normally do well. And then when either they or the family notice that there has been some change from that usual pattern of functioning, that should be a warning sign to people. But they don't have to check off all the boxes.
So Dr. Salloway gave us a great recap. And it's important to remember that this is a spectrum. It is not an all or nothing disease. These warning signs are intended to be a guide to help identify problems in memory, thinking, or behavior that may be related to Alzheimer's or another dementia. Individuals may experience one, all, or some of these signs to varying degrees, and in numerous or single occurrences. They don't have to experience them all for there to be concern. It's important to discuss any changes in memory, thinking, or behavior in either yourself or someone else with a doctor. Our next topic is early detection. It's key that we pay attention to what's going on in our cognitive health and not dismiss any changes in ourselves or others around us as normal aging. Any change that's unusual for your level of functioning or that of someone around you is a cause for concern. Many times, friends and family are the first to notice changes in someone's memory or behavior or their abilities. In this module, we're going to discuss why it's critical to address and any observed changes early and seek answers from a medical professional. So sometimes the person exhibiting symptoms isn't aware or may not have the insight to know that they're experiencing changes, which is why having an outside perspective is critical. This is especially important in individuals who live alone or are far from family and friends. Let's listen to Dr. Calloway again discuss this and then hear from a care partner who was the first to notice changes in her husband.
You know, it's a very interesting phenomena that people who have memory problems are often less aware of it than family members or their friends who know them well. One of the reasons for that is our ability to monitor ourselves, which is an important part of brain function, decreases when we start having memory problems. Not in everybody, but commonly, in more than half the people with memory problems. And so the person is just not keeping track of the trouble they're having day to day. But the family members are, you know, if they're paying attention, they see, boy, this is starting to happen a lot, and the person's not aware of it. So the family's more aware, and they may talk to their loved one about it, and they say, you know, I've noticed you've been repeating yourself. And they say, I'm not repeating myself. And that could either be due to the fact that they're not aware of it, or they may not want to acknowledge it.
Let's hear what Mary has to say about her husband while she was his care partner.
I was so adamant about what was happening to Daryl. I wasn't sure. I didn't know. And this wasn't the person that I know. This wasn't the person. My husband was very, he always had to be building or designing or working with his hands. And it was getting to the point where he wasn't, and he was becoming very frustrated when he was forgetting to do things or go places.
So what should you do if you notice changes in someone? So if you continue to observe changes, it's critical that you plan to take the next step and have a conversation with the person or others close to them about what you've noticed, just as Mary's daughter did for her. This can be a very difficult and uncomfortable conversation to have. The Alzheimer's Association has developed a roadmap of 10 helpful steps to help make addressing memory concerns less daunting and a little more productive. So let's take a look at those. So 1, start by assessing the situation. What changes in memory, thinking, or behavior have you seen? What is the person doing or not doing that's cause for concern? Number 2, what else is going on? Various conditions can cause changes in memory, thinking, and behavior. Are there other health or lifestyle issues that could be contributing to these changes? These would include stress, diabetes, or change in a person's medication. Number 3, learn about the signs and the benefits of early diagnosis. You've already taken the very important first step by joining me today for this program and to learn about these topics. But did you notice any of these signs in the person that you're concerned about or yourself? Number 4, has anyone else noticed the changes you've observed? Talk with friends and family of the person. What, if any, changes have they noticed? Number 5, prepare to have a conversation. Who should have the conversation to discuss the concern? It could be you, a trusted family member or friend, or a companion. It's usually best to speak one-on-one so that the person doesn't feel threatened or ambushed, but use what you know about the person to judge what approach works best. Number 6, when and where should the conversation be held? It's important to have the conversation as soon as possible. In addition to identifying a date and time, you should also consider where the person would feel most comfortable. What will you or the person having the conversation say? You may want to build out somewhat of a script. Consider the following questions. I've noticed insert change in you. And I'm concerned. Have you noticed this? Are you worried? How have you been feeling lately? You haven't seemed like yourself. I noticed you, insert example, and it worried me. Has anything else like that happened? Number 8, offer to go with the person to the doctor. Ask the person to see a doctor and offer to accompany them. Try using encouraging words such as, there are a lot of things that could be causing this. Let's see the doctor. They can help us figure it out. The sooner we know what's causing these problems, the sooner we can address it. Or, I think it would give us both peace of mind if we talk to a doctor. Number 9, if needed, have multiple conversations. Don't be discouraged if the first conversation isn't as successful as you had hoped. Write down notes about how it went so that you can prepare for the next conversation. Don't dismiss the changes you're noticing just because the person is reluctant to address them. Have the conversation again, even if the first one didn't go as planned. Reach out for support. You can always turn to the Alzheimer's Association. Call our free 24/7 helpline to talk to our master level clinicians who can provide reliable support and information, including tips about how to have this important conversation. And lastly, see a doctor. Most people address concerns about memory, thinking, and behavior with their primary care physician first. However, in some cases, primary care physicians or PCPs may refer the person to a specialist for future evaluation. Examples of specialists include geriatricians, neurologists, neuropsychologists, psychiatrists, and psychologists with special training in testing memory and other mental functions. We now know what signs to look for and how to approach the conversation. So let's talk about quickly the benefits of early detection.
There are a number of benefits in early detection of Alzheimer's. For one thing, a person is able to have a voice in what happens next. They can make plans. They can live life more on their own terms. They can also make plans for the future, financial plans, care plans. They can let people know what they want, which can be a real gift later on. It also allows time for families to make plans and to make decisions about who can do what and figure out care and those kinds of issues. Some people are interested in clinical trials. Clinical trials allow people to have access to treatments that aren't available yet. And for some people, that can be a really important thing to pursue.
Paying attention to changes you notice in people, especially regarding memory, thinking, or behavior, is important for early detection. If you do observe unusual behaviors or occurrences, take action by having a conversation about what you've observed. Consider using the 10 steps approach to memory concerns that we discussed just a moment ago to guide your conversation. Customize it so you're approaching the person in the most supportive way possible because you know the person best. There's a number of benefits to early detection, such as planning for the future, access to treatment options, and participation in clinical trials. Let's take a look at what may be involved in seeking a diagnosis. Let's start by testing your knowledge. This is pretty straightforward. True or false question. You can speak out loud or put it in the chat or whatever you feel comfortable with. So who here thinks there's currently no way to diagnose Alzheimer's or dementia? True or false? False? Let's see. The answer is false. You're correct. Contrary to an outdated belief that Alzheimer's diagnoses can be made only at autopsy, There are a number of assessments and tests that make it possible for healthcare professionals that we had listed previously to diagnose Alzheimer's and other dementias with a high degree of certainty. However, determining the cause of dementia can sometimes be more difficult. So here we're going to explore possible steps of the diagnostic process. Keep in mind that as we review these steps, not everyone may be asked to undergo each one by the doctor. Assessments may include medical history, a physical exam, screening for depression, interview with close companions, and tests may include laboratory testing, mental and cognitive status testing, brain imaging, and CSV, or cerebral spinal fluid analysis. So Mary's daughters are preparing to answer questions about the changes in their mom's behavior. They wonder, do dementia-like symptoms always result in the diagnosis of Alzheimer's or other dementias? So Mary's daughters say that the appointments have been going well, and their mom seems to be handling it okay. They want to know, is it really dementia? And they don't know unless they get a diagnosis. But let's hear what Dr. Salloway would say.
Someone could have high blood pressure that's out of control, or they might have a thyroid condition that's not regulated, or diabetes that's not right, or on a medication that actually can cause memory loss. Drinking too much alcohol can make memory worse. So there are a lot of factors that go into cognitive difficulty with aging that some of them can be remedied. And so we want to do everything we can to improve cognitive ability and quality of life.
So let's review. The diagnostic process will vary from person to person, depending upon an individual's specific situation and what the doctor feels is the right course of action for that person. The diagnosis may be something other than Alzheimer's or another dementia, which is why it's important to investigate the cause of the symptoms. Stigma and misconceptions about Alzheimer's, like nothing can be done, can deter some people from seeking a diagnosis. Getting information and support is also a critical next step. Let's learn a little more about what the Alzheimer's Association offers. So Mary's daughters, if the diagnosis is Alzheimer's, what's next? And although this is a fictional scenario, the Alzheimer's Association does get medical referrals from providers daily, and we follow up with those to offer resources and information to the care partner and the patient. So the Alzheimer's Association is in communities across the country, providing direct services to individuals and families facing the disease. So as we discussed last month, the Alzheimer's Association leads the way to end Alzheimer's and all other dementias by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. The vision of the Alzheimer's Association is a world without Alzheimer's and other dementias. Some things that we offer. The association is available wherever and whenever you need and for reliable information and support. 3 of our key resources can connect you with information and support. They include the 24/7 helpline at 1-800-272-3900. Day or night, we provide access to highly trained and knowledgeable staff who can help with education, decision-making support, and crisis assistance. These are master level clinicians, and they're available around the clock to provide in-depth care consultations, free of charge care navigation services, and offer those to families and friends for those suffering with Alzheimer's in any stage of the disease. We also have this available in 200 languages. Next, ways you can, I skipped alzheimers.org, alz.org. I apologize, getting ahead of myself. You can find these resources online as well at alz.org, and at community resources you can locate nationwide at alz.org/CRS, which is Community Resource Finder. Now, ways to join the fight. Now that we've taken a basic look at Alzheimer's disease and what resources are available, let's talk about how you can take action. Volunteer. Whether you can spare a few hours a week or make a more significant commitment, consider volunteering with the Alzheimer's Association. Advocacy. Become an Alzheimer's Association advocate and speak out on behalf of the needs and rights of those facing Alzheimer's disease. You can visit alzimpact.org. Trial match. Everyone can help advance Alzheimer's research by participating in clinical trials. Get started with the Alzheimer's Association Trial Match, a free, easy-to-use clinical studies matching service. Visit alz.org/trial match. The Walk to End Alzheimer's. I think I mentioned this last month. I had participated in about 3 of these events last season. They usually take place in the fall, at least in Kentucky. The Walk to End Alzheimer's, it's a you can form or join a team for the Alzheimer's Association Walk to End Alzheimer's and raise critical funds and awareness. This is held annually in 600 communities nationwide. And the longest day. The longest day start is the day with the most light, the summer solstice. You raise funds and awareness for the care, support, and research efforts of the Alzheimer's Association just by participating in the activity of your choice. I've got about 10 minutes if you guys have any questions. So that concludes the 10 warning signs of Alzheimer's presentation. So if you guys have any questions, if there's anything I was unclear about, I'm happy to take those.
Well, I thought that this was just a wonderful presentation. This was great.
Well, I'm glad. Thank you. I hope that it was helpful to you all.
Yeah. You know, we, as a caring place nonprofit, we do the Walk for Alzheimer's every fall.
Okay.
And yeah, and we've always done it with the university students, the Youth Movement Against Alzheimer's group. But this year, last year, we voted that we would do it all by ourselves. We would be our own team. So that's going to be kind of new and exciting. And of course, and we're going to invite other people besides what's in a caring place to be a part of that team. And we've already, now this is kind of exciting, we've already got people that have been asking, are we going to do our walk again this fall? And that some of them who can't walk are donating money. So it's like, wow, without even advertising, this is pretty good. So this is a good start, I think, to contributing something to the Alzheimer's Association and what you're all trying to accomplish, which is wonderful.
That sounds great.
Yeah.
Ms. Langford, I absolutely enjoyed that. That was very good, very informative. Thank you.
You're so welcome.
October 8th, for those who don't know, October 8th is the day we here in Lexington are doing the walk. So mark your calendars. Don't join another team.
You could join multiple teams. You could do multiple walks. You could do the one here in Louisville with me. You could do the one in Lexington.
Right. You could do that, but here in Lexington, you can only join one team.
That's right.
Right. So I don't want them. And last year I made the big mistake of not asking soon enough. So by the time I asked, it was like, oh, I always walk with this other team, or, oh, I'm going to walk with this one. And sorry, you didn't ask soon enough. So this year I'm trying to be 6 months ahead of time. I'm asking everybody. Mark the
Right.
calendar.
Roxanne, could you send me a
Yes.
little information on that? I didn't even know you had walk.
Oh, sure. Definitely. I will put out something to our group email for everybody.
Well, I would love to have that.
Okay. Yeah, because maybe you and Sherry can walk this year.
Well, I'd love that. I'd like that very much.
Oh, that would be awesome. All right. See, so there's 3 people already this year walking. So a good sign.
Dawn,
Yes.
I was wondering if there's statistics on how frequently people who are developing Alzheimer's recognize it themselves, how reluctant they are to accept it.
I don't have a specific statistic. There's actual, I'll have to look up the word. It begins with an A, condition where with Alzheimer's and or another dementia where it goes beyond denial. That there's anything going on. I know personally in my personal life with my family through all of the years that we've dealt with this, I lost 2 grandparents to Alzheimer's disease. And I had already mentioned my father who's currently struggling with it, and also members of my husband's family who's currently struggling with it. I can tell you every single one of those people have denial about what's going on. It's scary. No one wants to admit that they can't do the things that they used to do.
Right.
And that there may be something going on, because no one wants that stigma. There's a huge stigma that comes with being diagnosed, and that's such a shame. No one wants to have that placed upon them, because they think that they will lose the things, even though they are losing the things that they were once able to do. No one wants to do that. So I don't have a specific number, but I would assume that it is pretty high, those who do not admit or seek proper diagnoses for their condition. There's so many different conditions, so many dementias, not just Alzheimer's. Alzheimer's just happens to be the most common form of a dementia. So no, I don't have a statistic. I'm sorry.
That's fine. I was just impressed with the people who were talking about their conditions, and my experience has been that that people deny that there's anything going on, and it's
yes,
a hard thing for the families to try to make progress.
It is when the person, but it's not always, as I said, there is a condition that goes along with it that's just beyond denial. I mean, there's absolutely they will never admit, because they can't. It's not because they wouldn't if they could, they just can't. Understand that there's something going on, and you are so correct that it does make things much more difficult on the care partners, the caretakers, the caregivers, the family, the friends, even the medical providers of the person, because it's very difficult to provide care for someone if you're the medical provider, if the person is refusing to admit or understand that anything is wrong.
Yeah, refusing to admit, or as you said, just can't, because there's another condition that goes along with this disease.
Correct.
Is there
Stacy, do you have something too?
yes, is there an early age onset or any certain age?
There is no specific age. No, there is early onset or early what used to be called early onset dementias that usually occurs around, it can occur as early as your 40s. Typical onset, though, is not until 65 or older, and it increases every 5 years after 65. The chances go up dramatically. But there is an early stage or early onset dementia. Yes, there are. They usually start around age 40s into your 50s.
Hey, Dawn, occasionally you'll see an ad on television where this medication or this pill or whatever, they claim that they'll help your memory. I think they say it helps your clarity. Have you ever heard those, and do they do any good?
If you're talking about FDA approved medications,
Yeah,
are you talking about supplements?
I've just seen advertising where they claim they'll help your memory.
There are no over-the-counter things that are advertised on TV that I know of that the Alzheimer's Association recommends. There actually are no medications at all, over-the-counter or otherwise, that we can absolutely say for sure a person should try. That's always up to the doctor. You should always consult with your medical provider about supplements or FDA-approved medications. We just provide, the information about those things. But over-the-counter supplements that you see commercials for, I'm sorry, I don't have any information about those. But I would definitely, if you're interested in those things, ask your medical provider, someone who is, knowledgeable and trained in such things.
Sure. Okay. Thanks.
Stacy, did you have a question? It looked like you were going to ask a question.
It was more of a comment. I just wanted to thank you for separating the differences between what is an early sign of Alzheimer's and what's just normal aging, because I know with myself and with many people that I know, we're always going, is this normal? I can't remember where I put this. And it just it makes you nervous because you're not sure. So it really helped to see the list and to go through it, and especially the explanations of, if you can walk yourself through it, then that's just normal.
Right.
So thank you for that. That was a big help.
Oh, you're so welcome. I totally understand. I totally understand that. I question myself all the time. I'm like, but if you can retrace your steps, and if you're not doing it with every single thing you do every single day, that's the key. If it's not interfering with every single thing you're doing in your daily life, that's the key to normal aging versus cognitive impairment.
Thank you.
Hey, Roxanne or Stacy, have you heard how Bill's coming along this morning?
No, last time I heard was Bill, of course, is still on a ventilator and in a medical induced coma. And he might have been in a coma before he arrived at the hospital because he wasn't getting the kind of oxygen he needed because of his heart condition, right? So I don't know about that part. And he has cardiologists working on him because it is his heart. They can't get it back in a rhythm. And I think that most of you knew that he had atrial fibrillation, new onset. The very first time he went to the hospital, they found that. And then the infection he had seemed to land up in his heart. So he's been on IV antibiotics for that. So new onset atrial fib and an infection in his heart weren't good for somebody in his very vulnerable position. So as John Pop said, Lord, take mercy on Bill.
Of course, he's had MS for years, so that's another thing that.
Does he have any family here? Does Bill have any family at all?
He has a daughter who has multiple sclerosis also, but a much worse condition. She can't talk. She seems to be fairly bedbound when he describes it. So that's it. He was an only child himself. Now, I don't know, Stacy's known him for a long time. She might know a little bit better than me.
No, he lost his only relative here, his cousin, quite a few years ago. So I think he's it. And Jan is over there now. She just texted and she said that for some reason, if we want to go visit, we have to call first to see if he's available. So I don't understand what that means.
Well, I don't understand what that means either, unless they're taking him for a number of tests.
Okay, maybe so.
That's the only thing that I can think of when you're in intensive care. Usually they bring the test to you, but I think that because of his condition and having many different teams of cardiologists now in there working on him, plus the neurologist in there working on him, that there may be some tests that he actually needs to go down to radiology or some other place to have. They can't bring it up to the bedside. And even if they brought it up to the bedside, you wouldn't want to go in there while they were conducting like an echocardiogram.
Yeah.
So yeah, that's the only thing that I can think of. And I'm going by my nursing background, that we would tell somebody call because they may not be available.
Okay, thank you. Thank you. Well, and then his medical advocate said he is going to have everything possibly done before they make any kind of decisions for, end of life kind of things.
Okay. Jennifer, did you want to say anything? Well, maybe she's left us, huh?
Yeah, she was at the car dealer. Her car broke down,
Oh, yeah, I didn't know that. Well, anyway, our time, Roxanne, our time is passed us by.
Oh, and I had so many other questions. Dawn, are you going to come back next month?
Well, I don't know. Did you all invite me?
Yes, absolutely.
Yeah. Okay. All right. Then I'm sure I will be. Yes, ma'am.
Okay. Well, thank you. Thank you very much.
Certainly. Thank you all, and stay safe this weekend.
Thank you.
Thank you.
Bye-bye.
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 Okay, we usually end in prayer. Does anyone want to give us a prayer, or shall I do that today?
I can do it if you'd like.
Okay, go ahead, Stacy.
Lord, thank you for bringing us together. Thank you for all the knowledge and wisdom that you place in front of us. Lord, be with Bill. Help us to be whatever he needs us to be. Let him know how much we love him, how much he's cared for, that he does have family here. Please help us in this transition and help us to accept your will. Please bless all the women this weekend for Mother's Day. And please bring us peace and joy through your love. Amen.
Thank you.
Amen.
Very good.
I had forgotten it was Happy Mother's Day. Happy Mother's Day, everybody.
Happy Mother's Day to you.
Day. And I just realized we weren't supposed to use Lord. I am sorry for anybody. I apologize.
That's fine.
Bye,
You did a good job.
Thanks. Bye-bye.
Yeah,
Bye.
goodbye, everybody.
Thank you.
Bye.
Bye.